Welcome to the Health Channel, all health, all the time. I'm Kathy Buccio, coming to you from the Baptist Health South Florida studios. How do you tell the difference between the inevitable signs of aging and the early warning signs of a serious health condition? That's an important question, and today we're talking about peripheral artery disease, or PAD. In this case, early detection can lead to conservative treatments, which could save you money, save you complicated limb surgery, and maybe even save your life. And joining us to talk about PAD is Dr. Bernie Fernandez, Chief Executive Officer at Baptist Health Medical Group. Thank you for coming on the show. I know you're a busy man.
Thank you for having me.
So before we get into vascular health, I want to know what got you interested in it in the first place.
Oh boy, I'm taking this is a long way back.
Take
now,
it
Kathy.
back.
So I was doing my residency in internal medicine at the Cleveland Clinic in Ohio, and I remember there was a service on there at a specialty called vascular medicine. I knew very little about it. I knew I liked internal medicine, and it could become a fellowship, and that just piqued my interest in vascular diseases within the internal medicine field. And there came me doing a fellowship many years later.
I know we talked about a little bit off camera about how our vascular health ages just like we do. So explain a little bit about that to our viewers at home who may not know.
Sure. Well, it's real simple. The older we get, actually all of our organs, get older with us, our bones, our joints, well, so do the blood vessels. So as we get older, we are more likely to develop atherosclerosis, hardening of the arteries, and with that comes peripheral arterial disease.
Now, you talk about how this is considered the window shopper's disease, and why is that?
It's a funny term that's used to describe the symptoms that the patients get when they're walking. So typically you ask a patient, well, do you have any symptoms or you have any pains in your limbs? And they tell you, doctor, I go to the mall all the time and I never have any issues whatsoever. I said, okay, wait a minute, take me back when you go to the mall. When you go walking, well, actually you stop between the windows and you rest. So therefore, you never get to really experience any of the discomfort. But if you did push yourself to walk continuously without stopping to look at the windows, that's where the window shopping comes in, you actually will have discomfort.
Right.
So it's all window shopper's disease just for that.
Though we do have some statistics that I want to go over with you, because age plays a very big factor in our vascular health. So can you talk to me about the population and who experiences PAD?
Well, peripheral arterial disease can actually occur at any age. However, if we play the odds, as the graphic shows very nicely, about 2% of the population under the age of 60 have it. That increases then much more to 3.7% between the age of 60 to 70, and then almost 18%, almost 20% of the population over the age of 70 has evidence of actually peripheral arterial disease or symptoms of intermittent claudication. If you actually go and test the population and do a non-invasive test or questionnaires that are guided to bring out some of those symptoms, it's almost 20%.
Now, for those who are joining us right now, can you explain what is intermittent claudication?
Sure, very simple. Intermittent claudication is the symptom that patients experience when they have peripheral arterial disease. More commonly, it is known angina of the heart, means you have issues with your heart. Circulation to the coronary arteries is hampered by the plaque or atherosclerosis, and they get chest pain that's known as angina. Well, intermittent claudication, Kathy, is the same angina, pain, but in your legs.
In your leg.
You have a blockage or a narrowing. We're going to talk a little bit more about that. When you exercise, when you're walking, the exercising muscle requires more blood flow, and then it screams for help. We're not getting enough blood flow, and that's the pain.
And that's the pain. It's only when you stop to let that blood sort of catch up.
That's exactly, and that is why it's intermittent, precisely.
Got it. So let's go through some of these symptoms that someone might have if they have PAD. We have a graphic that shows us the warning signs, and if we can discuss these a little bit. You mentioned pain in your leg, tiredness. Dr. Fernandez, what are some other ones that we might be experiencing?
Sure. One of the things you want to look out for is the fact that it's intermittent. So it's pain in your legs that disappears after a few minutes of rest. What does that mean? The patient goes for a walk, he or she can almost predict the distance at which that pain is going to come on. They stop, they stand there, and the pain goes away. If you're experiencing tiredness or cramps in your legs when you're walking, these are also other ways that patients may describe it. I'm not talking about the cramps that wake you up in the middle of the night. That's a different This is a description that the patients may give you. I get a cramp when I walk.
Right.
So as a physician, we need to have a high incidence of suspicion. Now, if you have patients who have peripheral arterial disease and they also have diabetes, your patients may be experiencing some numbness or tingling or coldness in the legs. We're going to talk a little bit more about that. That's peripheral neuropathy. But again, these are things that you want to have in your mind. Slow healing ulcers or sores or infection in your feet. If you have patients with diabetes, that comes in. Pain in your feet or your toes, even when you're resting, also should alert. You've got to go get checked out.
And it's good to know that it's important to know though that these symptoms, they can all happen, or you can only get some.
That's exactly right. If we rely on, and I think we talked a little bit about it before, and I believe we may have a graphic on it later. If we rely only on identifying the patients that have symptoms of peripheral arterial disease or the intermittent claudication, we're only going to find a minority of those patients.
Right.
Majority of our patients do not have any symptoms whatsoever.
And I want to talk about that because that's actually the most challenging, when you have no symptoms of PAD, but you actually do have PAD. So what happens?
In those patients, unfortunately, if you do not identify that they have peripheral arterial disease, you're going to miss a great opportunity to engage with that patient to improve their lifestyle. They may not be very active. Number two, to prevent other problems.
Right.
You lose the opportunity to prevent heart disease. You prevent opportunity to prevent stroke, improve the patient's mortality by really aggressively modifying the risk factors that can cause all these other comorbid conditions.
Because I think that's exactly the point we want to drive home, and I think that's something that you had mentioned, Dr. Fernandez, is that just because it's PAD, it's something treating the leg, what we're really trying to avoid is issues everywhere in the body, as in our heart, preventing a stroke, correct?
That is correct. It's the associated comorbid conditions, heart disease, neurologic disease, or strokes. That's really is what's going to determine how that patient is going to be doing over the long term, not so much the legs.
So you talked to us a little bit about the patients that have no symptoms, but now what are some of the typical symptoms of PAD?
The typical symptom, again, is that intermittent claudication we discussed. Patient goes for a walk. He or she cannot reach a block. They have to stop halfway through, and the time that they're walking, they stop, they stand there, the pain goes away, and then they start again. That is your very typical book description of the patient with intermittent claudication or peripheral arterial disease. Again, that's only a minority.
A minority.
People describe it in many different ways. As we get older, we believe that leg pains are something that we're supposed to experience. So the patient may not even bring it up to the doctor's attention.
They may chalk it up as, we're getting old.
I'm getting older, I'm okay to have leg pain. So you know what, I'll just sit here and avoid it. So we actually have those patients sit down, they become even more sedentary, and that just perpetuates a whole cycle.
Now, who's at risk for PAD?
Your typical patient for PAD is the same patient that's at risk for heart disease. Let's think of it that way. That is the patient who has high blood pressure, patient that has high cholesterol, patient that may have diabetes, patients who are obese, patients who are sedentary, and very important, the patient who's a smoker.
Always stop smoking. You're
That's
watching
it.
this, stop smoking.
That's exactly correct.
Absolutely. Now, we talked about something called atherosclerosis. What is that, and how does it cause PAD?
Sure, absolutely. Atherosclerosis is your typical that you all hear about what causes heart disease. It's the same process that occurs in the heart, in this case occurs in the legs. So a plaque grows, the plaque begins to interfere with blood flow inside of the lumen of that blood vessel, and it begins to block it and narrows it, so the blood flow that goes through is impeded or diminished, and therefore it causes the discomfort in the leg.
And now, is all the PAD cases caused by atherosclerosis?
The great majority of the PAD
Okay.
cases, there are other more esoteric conditions like vasculitis that can cause that, but in the general cause of it is atherosclerosis or plaque formation in the limbs.
Now, cholesterol. Let's talk a little bit about that because I feel it's one of the factors.
It is definitely hypercholesterolemia, hyperlipidemia is one of the risk factors for the development of those plaques in the blood vessels.
And then what happens? The plaque buildup causes...
The plaque continues to build up. There are other inflammatory factors, hypertension, smoking, genetic, all play. It's a very dynamic process. And with time, if it goes unchecked or untreated, that plaque continues to grow and eventually begins to occlude or begins to form a smaller lumen
Right,
or a
closing
smaller
things.
vessel, so it begins to block the circulation.
Now, I'm a fan of visuals because I think things get better explained. And we have a great visual here that you were going to show us, Dr. Fernandez, of a PAD and how it works and affects our body. So what are we seeing here exactly?
So this is a typical blood flow. You see that the red blood cells are carrying the oxygenated blood to the tissues, and then you see the normal blood vessel in the background. Then you see this area here. This is your typical plaque that develops over time.
Wow.
And that plaque then begins, as I said, cause a narrowing in the lumen of the blood vessel. So these don't go through there as normally they would, thus causing the part that is beyond that blockage to receive less blood flow. Therefore, that's where you get the symptoms.
Right. So when we were talking earlier about the window shopper's disease, and it's because as we're seeing right now, someone's walking, and then they stop. And that, what we're seeing is, let's say, allowing that blood flow to come back, correct?
That is correct. So when you're walking, imagine this is where the exercising muscle is. The exercising muscle requires more blood. It's got to give it more gasoline. Imagine your car. When you need to go faster, you step on the gas. When the gas is diminished, the car sputters. Well, when you exercise a lot, this plaque doesn't allow more gasoline or more blood to go that carries all the oxygen, so that you get the cramp or you get the discomfort or the pain in the limb. The patient stops. The muscle is now resting, so it allows the blood flow to catch up, and the pain begins to disappear.
I want to quickly talk about, before we go to break, to improve these leg symptoms, something that we're seeing. When you talk about the walking program, which you use a great analogy to describe something that can help this blood flow. What is the walking program in terms of helping someone with a leg issue with PAD?
Sure. One of the things that we do with the walking program, we'll talk about it as a treatment down to the segment, is essentially you're teaching your blood, not teaching your blood, you're teaching your muscles to work with less blood flow to them. So you're training your muscle to work in a more efficient environment with diminished blood flow. And in some cases, you're able to demonstrate that there's blood flow increases, so the distance at which the patient gets the symptom or the pain in the leg actually continues to increase over a period of time. If you've done it for 3 to 6 months and you were able to walk only half a block at the beginning, if you really do this every single day, we'll talk about it later, the actual structure of the exercise, they should be able to walk a block and a half, 2 blocks, and 3 blocks.
So kind of, you are teaching your muscles.
You're teaching your muscle, you're training your muscle to work in this environment. That is correct.
Thank you. So we have only scratched the surface here, but coming up next, we will find out how doctors diagnose PAD and whether you have symptoms or not. And later, we will talk to Dr. Fernandez about simple tips to avoid the worst case scenario. You're watching the Health Channel, all health, all the time, on South Florida PBS. If you have a question for Dr. Fernandez, please call in using the toll-free number, 855-796-4475. And please be sure to visit our website, allhealthtv.com, where you can watch videos from previous episodes or submit questions for the experts. We'll be right back.
C stands for cutting-edge research, clinical trials, and collaboration. Creating breakthrough treatments as Florida's only member of the Memorial Sloan Kettering Cancer Alliance. At Miami Cancer Institute, C also stands for Cure. World-class cancer care right here at home. Learn more at miamicancerinstitute.com.
Every year, millions of Americans are exposed to a contagious virus.
What is this virus? It's stigma.
Stigma promotes an environment of shame,
fear, and silence.
which prevents millions of people from seeking help.
But there's good news.
The National Alliance on Mental Illness believes stigma towards mental illness is 100% curable.
So do yourself and everyone a favor.
Go to curestigma.org and get tested for stigma.
It started with the original care package and millions more like it. Passed from hand to hand, across land and sea, to help survivors in the aftermath of war. As we grew, we found better ways to help those in need. Ways to make a real difference, not just today, but tomorrow as well. Be the difference in people's lives. Help deliver lasting change at care.org.
Welcome back to the Health Channel, all health, all the time. I'm Kathy Buccio. And with us is Dr. Bernie Fernandez, Chief Executive Officer at Baptist Health Medical Group. Now, if you have a question for Dr. Fernandez, you know what to do. Pick up the phone and call 855-796-4475. We would love to hear from you. We're talking about peripheral arterial disease, or PAD, something that can become very serious if left untreated. But some people have no symptoms, and that's the challenging part. So when should someone talk to their doctor about PAD? And that's something that you and I were talking off camera. Do people need to get screened for PAD? How does it work?
Ideally, again, part of our push by the Society of Vascular Medicine has been, let's go ahead and identify the patients as early as possible,
Right.
so that we can engage in preventive and treatment directed at slowing down the disease. So if we can bring up the first graphic.
We have yes, if we can talk about first the questions that the doctor may ask a patient, right, in terms of PAD and if they have symptoms for PAD.
Right, and these can be asked by either the doctor or the nurse at the office. In particular, do you develop any cramping or fatigue in the legs or muscles on either leg when you walk? And why do we say the muscle? It is important that we try to identify that it's specifically in the muscle. Peripheral arterial disease is not a pain in the joints, which is typical more for arthritis. These are muscles that require large amounts of blood. So when you're exercising, those are the parts that actually develop the discomfort. So it's an important question
Right.
that it's screening, it's very simple, it's very quick, and then that can have you then dive deeper into identifying the patients who may have the discomfort. Do the symptoms only start when you walk?
Right.
That's important. Again, that's the intermittent piece. The questions that the exercising muscle requires more blood, you're not getting it, you've got to delve deeper into that. Do the symptoms resolve once you stop walking? Well, again, simple. The fact that your muscles require more blood when you're exercising, when you stop, the requirement of blood flow decreases. So the blood flow, if it's narrow, it's able to catch up, the pain goes away. Typical thing, the patient, all they need to do is stand in place. They don't need to sit down. They don't need to lean on something else. They don't need to kneel. All they need to do is just stand in place, allow the blood flow to catch up, and the symptoms will go away.
Right.
Typically, 5 minutes, 10 minutes maximum. If it requires longer than 10 minutes or 15 minutes or a half hour or an hour, or the symptoms don't resolve, it probably is not peripheral arterial disease as the cause of it. So it's very, very typical. And then we talked already about the symptoms. They go away by just standing in place or at rest. Do they then come back again if you walk the same distance? And patients can actually begin to predict when that happens.
And they know exactly when.
And they know exactly when. So they either They know exactly what they need to go and stop.
Right.
Again, back to the first part of the show today, the window shoppers. They know exactly when it's going to come out. They stop, they stand there, they look at the window, and they wait there for a few minutes. When the pain goes away, they continue walking again.
Now, I want to make note that these are actually questions that you give your students as they would ask a patient, because you teach
That
as
is
well.
correct.
And when they ask questions like this, are you hoping to find something deeper in terms of PAD, or is it sometimes can say, you know what, this is a case of someone getting older? So how would you?
That is exactly what I tell the medical students at, when I teach at the Herbert Wertheim College of Medicine at FIU, is begin to ask the question.
Right.
Do you have pains when you walk? If the answer is yes, then you begin to look at the pattern, and then you can actually evaluate that patient with a very simple test that we're going to talk about a little further ahead. That will place you much ahead of the patient in preventing heart attacks and strokes by identifying those patients that have PAD or intermittent claudication.
Now, this is a question I really definitely want to know, and I think our viewers at home want to know as well. We talk about tests that are used to diagnose PAD, and there's actually one that you were explaining earlier to me off camera that is used, and it's actually one of the most successful one, which is what?
It is. It's not only is it one of the most. So here's what I would recommend. You go to your physician's office, and make sure that he or she examines your pulses in your legs, right? In particular, the pulses in your feet. If there's any question, or you may have symptoms of peripheral arterial disease, the test is called the ankle brachial index. It's a very simple test using a blood pressure cuff and a handheld Doppler, and you basically compare the pressure in your ankle to the pressure that you will take in the arm, also using a handheld Doppler. And when you compare the ratio of the two, it should be 0.9 or greater. There should be no difference between your ankle.
They should be the same.
And your arm. It should be exactly just about the same, 0.9 or greater. Anything less than that tells you within 95% specificity and sensitivity that that patient has peripheral arterial disease.
Wow. And does that also give a diagnosis for maybe other vascular diseases as well?
Well, absolutely. It can do it for any cause of vascular disease in the limbs, but it should alert you to the patient if he has PAD. That patient has atherosclerosis most likely in other parts of the body, including your carotid artery. So again, the risk potentially for a stroke. So the doctor may want to examine or listen for what's called a little sound that's made on the stethoscope. It's called a carotid bruit, little.
And that is
and then that could be a narrowing in the carotid artery that can cause a risk of a stroke. Or the patient or the doctor has to also be aware that the patient has likely coronary disease and a likelihood of having coronary artery disease.
Now, if patients with vascular diseases should be tested for PAD as well, or no?
I'm sorry, repeat that again?
Should patients with other vascular diseases be tested for PAD?
Absolutely. If you have a patient who has heart disease, right, which is a atherosclerotic heart disease, and that's a very good question. You want to know if your patient has PAD for a simple reason. You may want your patient to be more active. You want your patient to exercise. You may want them to walk. Well, if the patient has pains in the legs when they walk because of PAD, he or she may refuse to walk because it's uncomfortable.
And that brings me up to your pie graph. I want to talk about your pie graph that you actually share with your students, and you have it here with us. You're going to share with our viewers at home. And this is the same thing. If things that can be missed.
Absolutely.
Talk about that, Dr. Fernandez.
So this is a very nice graph. It basically says if a doctor relies on finding the patients who have peripheral arterial disease only by looking for the typical symptoms of intermittent claudication, he or she is going to miss the majority of the patients who have peripheral arterial disease. So you got to have a high level of suspicion. You've got to, look at the patients. So that's a blue part on the chart that says these are atypical. Atypical may mean that the patient has difficulty explaining to you exactly that you have the intermittent claudication. So the patient may describe it as a cramping or a fatigue rather than the sharp pain. And then you have other ones that actually the red ones probably are not as important for identification because these will be relevant already when the patient comes. These are people who already have very advanced vascular
PAD,
disease,
right.
and those patients are already in need of surgery. But what you want to do is identify the patients that have either the typical symptoms or the ones that don't have it, because you can, again, engage them. You should engage
Right.
them in preventing the other vascular problems.
Now, can PAD be treated?
PAD can definitely be treated.
How?
Number one, and modifying all the risk factors with the lifestyle improvements. If the patient is a smoker, absolutely, smoking plays probably the most critical role in the formation of peripheral arterial disease, and in the treatment, it is absolutely mandatory.
So
that the
patients
patient stops smoking.
patients that you may have seen in the past, they're number one. They came in, are they mostly smokers?
The majority happen to be smokers or former smokers. That is exactly correct. There's a super strong association between peripheral arterial disease and smoking. And the patient that continues to smoke will have more complications due to the peripheral arterial disease. If you have done an angioplasty, if you've done a vascular procedure or a bypass, those patients that continue to smoke are most likely to have that bypass or angioplasty or stent fail than the patients who actually quit smoking. It's really that dramatic.
It is that dramatic. And before we go to break, one more thing. What happens if you are not treated for PAD? If it's left untreated, if you're one of these that you have no symptoms, or even if you didn't go see a doctor?
Then the bottom line, you're missing a great opportunity with your patient to prevent something more devastating.
Right.
You're bypassing an opportunity to prevent a heart attack or a stroke, to really treat those patients aggressively with their blood pressure, get them to quit smoking, control their diabetes, all those things. If you identify your patient, you should aggressively treat them as if they have coronary disease or heart disease.
And then that 30% mortality rate.
That basically goes without question. That patient, you're not going to be able to, if you don't identify them,
Right.
you're not going to have that opportunity to prevent that 30% mortality rate.
And we're going to discuss that more, because we're going to talk about the connection between diabetes and PAD. Plus, we'll talk more about how serious complications of PAD, and can tell you about what to do and how to avoid the worst outcome. You're watching the Health Channel. All health, all the time, on South Florida PBS. If you have a question for Dr. Fernandez, why not call in? Use the number 855-796-4475. And please be sure to visit our website, allhealthtv.com, where you can watch videos from previous episodes or submit questions for the experts. We'll be right back.
At Miami Cardiac and Vascular Institute, we're celebrating our 30th anniversary. 30 years of pioneering minimally invasive techniques. 30 years of hard work and dedication by our top-tier leadership and world-renowned physicians and clinical staff. Creating a world-class comprehensive heart and vascular care center unlike any other. Committed to our guiding principles of outstanding quality care, continuous innovation, and a drive to save lives. 3 decades of excellence are the foundation for our exciting new expansion. A state-of-the-art facility, a first-in-the-world environment, with the latest technology. Recognized as one of America's best hospitals. We're proud of our history and committed to providing the best care today and in the future. We are innovators. We are leaders. We are Miami Cardiac and Vascular Institute at Baptist Health, South Florida.
1945 to 1965. People born during these years are 5 times more likely to have hepatitis C, a leading cause of liver cancer. And people can live with hepatitis C for decades without any symptoms. The good news? Now, treatments are available that can cure hepatitis C. So if you were born from 1945 to 1965, talk to your doctor about getting a blood test for hepatitis C. It's the only way to know.
everyone deserves a decent place to live.
Everyone.
When a future homeowner partners with Habitat for Humanity to build or improve a home, they build a better future for themselves and their families.
For my family.
For my family.
For my family.
With a little help, we all have the potential to stand on our own.
Potential.
Visit Habitat.org to provide help to families like these today.
Thanks, Coach. Thanks for teaching me about teamwork and leadership.
Thanks for showing me that sports help me stay healthy and do well in school. And thank you for teaching me about concussion.
Letting me know that I should tell you if I think I have a concussion. And how to protect my head and brain. Because one day, I want to be a teacher, an astronaut, scientist, or a coach, just like you. Thank you for protecting my future.
CAR T-cell therapy is a revolutionary new treatment for cancer. Healthcare companies developing CAR T immunotherapy use Thermo Fisher's Dynabeads technology to isolate, activate, and expand T-cells that have been genetically engineered to recognize and fight cancer cells.
We're taking the patient's own cells and enriching those cells to fight the cancer.
For more, go to thermofisher.com/CTS.
Welcome back to the Health Channel, all health, all the time. I'm Kathy Buccio. And with us is Dr. Bernie Fernandez, Chief Executive Officer at Baptist Health Medical Group. If you have a question for Dr. Fernandez, please call in using the number 855-796-4475. We would love to hear from you. Now, rare but possible consequences of PAD are amputation and an early death. Risks that can increase complications include smoking and family history. And we do have a list, so let's go through these. And the first one on there, what do you think it is? Smoking. Smoking is, if you're smoking, please stop, correct?
There's no way around it. Smoking is absolutely critical to the success of the treatment of a patient with peripheral arterial disease. So smoking, and however you can partner with your physician and all the resources that we have in the community is critically important. Then the other things, the other parts of the list are your typical high blood pressure, treating your high cholesterol levels, if you're overweight or sedentary, improving that. Now, the last three, it's very difficult for you to alter, but these are things that, again, should also be known that once you're hit over the age of 50, obviously PAD, if you have a family history of heart disease or stroke, all these are things that are go along with the development of peripheral arterial disease.
You're more at risk.
Absolutely. But smoking, again, critically important. And the other one that's not on the list, I just realized that it's having diabetes. Also increases significantly. I think it's about 10 times the chances of a patient having peripheral arterial disease.
And that's what we're going to talk about this block. But one of the things I wanted to mention, I always like to say, is like Baptist has a great walking trail. We can use our Baptist Hospital walking trail and get our exercise in because it's important to have that heart pumping, that blood flowing. Is that correct?
That is absolutely correct. And we make it available to the entire community. Right. Anyone that wants to come and walk on our walking trail, you've got beautiful lakes, and we've got a little construction of the hotel going up now, but short of that, it's a beautiful environment for people to exercise.
Absolutely. And now we have a graphic here, a slide that you're going to show us, and just to reaffirm everything we talked about before, how these overlap of atherosclerotic disease works, correct? The coronary disease with the peripheral arterial disease.
That is correct. And this is a graph that I wanted to highlight why we concentrate so much in identifying the patients with peripheral arterial disease.
Yes.
Basically just highlights the fact of the large overlap that you have between coronary disease or heart disease and cerebral vascular disease or potential causes of stroke. All these three overlap each other. So when you identify the patient with peripheral arterial disease, we as physicians, we have to think of that patient as having already coronary disease or cerebrovascular disease. They just go hand in hand.
They just go hand in hand. Now we're going to bring in their diabetes. And according to the American Diabetes Association, 1/3 of people that have diabetes and are over 50 years old have PAD. And many of those don't even know that they have it. So what is the link between diabetes and PAD?
Well, it's simple. Diabetes is a process whereby having high blood glucose levels accelerates the formation of atherosclerosis. So those plaques develop in the patients with diabetes typically about 10 years earlier than in a patient that doesn't have diabetes. So if you're looking at patients over the age of 60 as one of the risk factors of having peripheral arterial disease, if you now have diabetes, you can look, that patient probably started back when they were younger than 50.
Does it affect the health the same way though?
It does, except it makes the diabetes and peripheral arterial disease tends to be more aggressive.
Okay.
And it tends to be more distributed than in a patient that doesn't have diabetes. So it tends to be more virulent, would be the word we would use in medicine, than the patient that does not have diabetes.
So how would you treat that? How do you treat both a patient that has diabetes and PAD?
You have to aggressively treat the diabetes. You have to make sure the patients have, again, as normal as possible blood glucose levels, making sure that their cholesterol is being treated, making sure their blood pressure is being treated, and again, smoking, making sure that patient is not smoking.
And we talked a little bit about how challenging sometimes it can be as a physician to have people modify their lifestyle, modify their diet, things that would reduce the risk for heart disease and for heart attack and stroke, especially with someone with diabetes and PAD. Is this true? That
is absolutely correct. One of the, again, it's one of the things that we know in medicine. If you have peripheral arterial disease and a smoker, those patients tend to be really addicted to smoking. Likewise, talking about lifestyle, when you have peripheral arterial disease, you don't want to exercise because it hurts. You have calf pain. Who wants to have pain? So what do people and our patients do? They become more and more sedentary. So that just perpetuates the whole bad cycle of the problem.
Now, are there other risks associated with having both of these conditions?
There's definitely a risk of having both peripheral arterial disease and diabetes. And that would be when we're going to talk a little bit more about it. If you happen to develop a sore or an ulcer that is typically known in your foot, having PAD and diabetes actually inhibits the healing process of those ulcers or those wounds that occur in the legs. So that just makes it much more difficult to treat.
I know that you have a patient story that I want you to share because this happens sometimes. Another thing we're going to talk about is the neuropathy, that is included when you have diabetes and you have PAD. And I know that this happens to your patients in the past, correct?
That is correct. Let me just share a story with our viewers. You're probably very familiar that one of the most common causes in America of peripheral neuropathy is diabetes. Let me explain first, and I know we're going to do it again, and it bears repeating many times anyways. When you have high blood glucose levels or diabetes, that begins to affect the circulation not only in the body, but also to the nerves. So the nerves also become affected. So patients typically cannot feel in their feet, or they may have tingling or numbness. They may not even know the position of their foot. So they may have a wound in the bottom of the foot and not be aware of it. So the story I shared with you earlier was simple. Some of my patients in the past, not uncommonly, would actually accidentally drop a nickel or a dime or a quarter inside of their shoe, and they will come to the office wearing a shoe like they normally would to go out. When you take off their shoe, they have a loose change inside of their shoe.
And never felt it.
And never felt it. And the extreme example that I had during my training was a patient actually came walking with the shoehorn inside of his shoe and was not aware of the shoehorn. They were stepping on the shoehorn the whole time.
And this is one of the things we're going to talk about in the next segment, but I want to go through some numbers with you. And these are statistics for PAD patients who are diabetic. So tell us more about these and how serious having diabetes and PAD can be, because some of these percentages are big.
And this is something that we as a society need to emphasize, because it's all very preventable. There's no reason that patients, if they do the right things, so we can talk more about it, and we will talk about it some more, but 15% of all the patients that have diabetes experience a foot ulcer at one point in their life. 40 to 50% of the non-traumatic, non-accident, non-war amputations that are done in this country are done in patients with diabetes.
That is a scary number.
It is 40 to 50%. 42% of those patients in whom undergo an amputation will lose the other leg in 1 to 3 years, and 56% will lose the other leg in 3 to 5 years.
And that, Dr. Fernandez, is cause for concern because now we're dealing with someone with even more of a disability.
That is correct. Imagine the disability with one leg missing, imagine with the contralateral limb missing, the amount of disability, the amount of cost, the amount of heartache, the limitations that we put on the patient's lifestyle by having something like this occur. And it can be preventable.
Right. Now, what advice would you have for someone a patient that may come in or someone with diabetes?
If you have diabetes, the most important peripheral neuropathy, what sorts of things that you must do to prevent any foot ulcers, like proper shoe fitting, proper exercise, proper nutrition, and no smoking.
Now, we want to be proactive, but what about early detection?
Early detection is absolutely critical. You want to make sure that you detect it before it becomes a problem.
Absolutely. So coming up, slow healing sores on the feet and leg infections can all be symptoms of PAD. We're going to talk to Dr. Fernandez about how these can become critical symptoms fast. You're watching the Health Channel, all health, all the time, on South Florida PBS. If you have a question for Dr. Fernandez, please call in. The number is 855-796-4475. You can also visit our website, allhealthtv.com, and follow us on social media at allhealthtv. We'll be right back.
C stands for courage, collaboration, compassion, and sometimes even cuddly. At Miami Cancer Institute, C also stands for cure, world-class cancer care right here at home. Learn more at miamicancerinstitute.com.
Hello, I'm Dr. Jose Sosa with Baptist Health Primary Care. Dementia is not a specific disease. It's an overall term that describes a wide range of symptoms associated with a decline in memory or other thinking skills, severe enough to reduce a person's ability to perform everyday activities. While symptoms of dementia can vary greatly, at least two of the following must be significantly impaired to be considered dementia: memory, communication and anguish, ability to pay attention, reasoning and judgment, visual perception. If you feel like you or someone in your family might be experiencing these symptoms, contact your primary care physician so that an evaluation can be performed.
Welcome back to the Health Channel, all health, all the time. I'm Kathy Buccio, and with us is Dr. Bernie Fernandez, Chief Executive Officer at Baptist Health Medical Group. If you have a question for Dr. Fernandez, please call in using the toll-free number 855-796-4475. We would love to hear from you. And we do have a caller on the phone. It's Isabella from Miami. Isabella, are you there?
Yes, I am.
Hi, how are you?
I'm fine, thank you.
If you have a question for Dr. Fernandez?
Yes, I do. I've been diagnosed with coronary artery disease, and I wanted to know regarding the PAD that you're speaking of. I think I'm trying to find out, how do you know if you have the PAD, and is it detrimental to coronary artery disease?
Hi, Isabella. Good morning.
Hi.
Thank you for calling. You've got a wonderful question, and thank you for taking the time to call. So, if you have been diagnosed with coronary artery disease, I am certain that your physician is already treating you aggressively to make sure that your cholesterol is low, that you do not smoke, that your blood pressure is under good control. Now, if you are exercising every day, Isabella, and you go for a nice walk around the block, if you're able to do the entire block or two without stopping at a normal walking pace, without any symptoms of pain or discomfort in your legs, it is likely that you do not have peripheral arterial disease. That being said, I am certain when your doctor examines you, he feels the pulses in your feet. So if your pulses were bounding and they were normal, most likely you do not have peripheral arterial disease. Now, there was another interesting part of your question, and that is, if I have peripheral arterial disease, can it be detrimental to my coronary disease? And the answer is probably not, and let me explain why. You already have the coronary disease. The only reason that PAD can be detrimental to you would be if having the blockage in the leg arteries doesn't allow you to do the exercise that your doctor would want you to do, and that because you do have more widespread atherosclerosis, meaning in your legs as well, we just have to be more aggressive than if you didn't have it. And I hope that helps you, Isabel.
If you get options from your doctor. So I know it's rare, but amputations, they happen, correct?
That's exactly correct. It is unusual. Every time we diagnose a patient with peripheral arterial disease, and we tell them what the process is, hardening of the arteries, can become a blockage of the arteries, the first question the patient always has, doctor, I'm really scared. You're telling me I've got a blockage in my leg artery. Does that mean that I'm going to have an amputation?
Right.
And my answer is no. It's if you have your typical claudication symptoms of peripheral arterial disease, and we follow you over a 5-year period, the likelihood of you having an amputation is maybe 4%.
Right.
Over 75% of the time, that patient will continue to have a stable intermittent claudication or stable leg pains, stable peripheral arterial disease when it comes to the limbs. But amputations are very unusual, and the patient has peripheral arterial disease.
Now, I want to talk more a little bit about peripheral neuropathy, something that we've been mentioning throughout the segment, but we're focusing on this block. What is it and what causes it?
Peripheral neuropathy is primarily in patients that have diabetes, and it's the condition that actually causes those nerves to be afflicted such that they don't function normally from either having high levels of glucose surrounding the nerves or the little vessels that feed the nerves being narrowed by atherosclerosis as well. So the patients then begin to develop the symptoms of peripheral neuropathy: tingling, numbness, burning in the feet, and with that also comes a condition that the patients don't feel
the loss of sensation.
The loss of sensation in the foot.
Now, if a patient has the diabetes and the neuropathy, Can they manage their PAD? I mean, how does this work now?
You basically have to aggressively treat the peripheral arterial disease, obviously with the risk factor modification that we talked about earlier in the show. You also now have to aggressively engage in prevention of ulcers, prevention of trauma to your feet, things that normally we would do, like do a hot water bath for your feet or soak in your feet or no-nos in patients with peripheral neuropathy. Ideally, because if the water's too hot, the patient that doesn't feel what's going on, they soak the feet, they can essentially burn the feet without not really know what's going on.
Like you said, they can get well cooked because they're not getting that sensation in their feet.
They don't have that feedback, exactly. That's correct.
Wow. Now, how common is peripheral neuropathy?
Peripheral neuropathy it's quite a common condition. We see it rarely, perhaps because my practice was primarily all in peripheral vascular, but we see it very commonly. The patients bring it to the attention of the doctor when they begin to feel numbness or tingling in the feet. Ideally, their primary care doctor has tested their sensation in the feet, what's called a monofilament test, a real simple test where you swipe the bottom of the foot. If the patients feel it, likely they don't have peripheral neuropathy. If they don't feel it, they have it. The patients then need to be treated very carefully. Things that we can talk about later, obviously the shoes that they wear have to be comfortable. They should not be walking barefoot at all. I've had patients who have sustained an injury to their foot with the toothpick, their own toothpick fell on the carpet, and they stuck it inside the foot, and they had no idea that they were walking around with a toothpick inside the foot.
Wow. Dr. Fernandez, this has been an enormous amount of information. I wish we had more time, but thank you so much for being here.
Thank you for having me.
And if you're watching this, stop smoking and change that lifestyle and help your vascular health. Thank you so much for joining us, and it's been a real pleasure to have you and this topic on the Health Channel. And that's a wrap for this hour. Be sure to join us next time on the Health Channel, allhealthtv.com. And follow us on Twitter and Facebook at allhealthtv, where you can get health tips from our experts and see what's coming up. Thank you. This is Kathy Buccio.
Like millions of Americans, Emma was living with high blood pressure and didn't know it. There were no early warning signs or symptoms. But Emma's heart was working overtime, putting her at risk for heart disease and stroke. Following a physical, Emma was diagnosed with high blood pressure, also called hypertension.
People of all backgrounds can develop high blood pressure. Treatments differ based on risk factors including age and family history. But hypertension can often be controlled with healthy habits and medication when necessary. Eating more fruits and vegetables, following a low-salt diet, exercising regularly, and quitting smoking are often the first lines of defense to control high blood pressure. Your doctor may prescribe one or more medications to help lower your blood pressure to normal. Some rid the body of extra sodium and water. Others reduce the heart rate or relax the blood vessels. Always take medications exactly as prescribed and don't skip doses. While medications can effectively lower blood pressure when taken correctly, each type has potential side effects for some people. You might feel tired or have trouble sleeping. You may experience a dry cough, stuffy nose, leg cramps, frequent urination, or headaches. If you have side effects that don't go away with time, don't just quit taking your medication. Talk with your doctor and pharmacist, as there may be other medications or different doses that can control your blood pressure and have fewer or no side effects. Focus on the benefits. Taking your medication regularly will lower high blood pressure and protect your brain, heart, and kidneys from life-threatening consequences like stroke or heart attack, often the first scary signs of hypertension when left untreated. Control your blood pressure and reduce your risk by knowing your goal numbers
and monitoring your blood pressure at home or at your local pharmacy in between doctor's visits.
How's Franny?
She just graduated from obedience school.
Pharmacists play a key role in working with your physician to improve blood pressure management. We can address medication concerns and challenges. So talk to us about your treatments and goals outlined by your doctor. If taking your medication feels like a chore, don't just stop taking it. We can counsel you on working through side effects or determine when you need to see your doctor about possible changes in your medications. And we'll share healthy lifestyle tips to keep you on track. Whether you monitor your blood pressure at home or in the pharmacy, we're here to discuss your numbers and provide guidance. Okay, Emma, you're all set. I'll see you back here soon.
If you're at risk for type 2 diabetes, it is very important to increase your physical activity. Most people need to start slow. Get motivated by doing something you enjoy. Here are 5 simple steps to get moving. Number 5, exercise while you watch TV. You can do arm or leg lifts. Simple weights or canned goods can be used. Number 4, take the stairs. Start slow. It raises your heartbeat and builds muscle strength. It also works your lungs and waistline. Number 3, go outside. The world is your gym. Explore. Do things you enjoy. Discover a new park, play catch, bike. Spending time outside raises your levels of vitamin D and puts you in a better mood. Number 2, dance around your home. It is a great form of exercise and fun. You can burn 300 calories in just 30 minutes. Number 1, walk. Do it alone or with a friend, anywhere, anytime. It is the ideal low-impact exercise.